Health is where we spend quite a lot of our money. About 30% of our entire budget goes to healthcare. And this is the biggest department that we have. We started by starting to build a big hospital, a state-of-the-art hospital, and phase 1 is near completion. I'm hopeful before the end of this year it will be ready to be operationalized. This is a 750-bed hospital that we are going to build in phases. Phase 1 is nearly ready, and there will be do other phases. But in phase 1 is where we have a lot of equipment.
This is going to serve as Western Nyanza Regional Medical Tourism Destination Hub. We envisage to cater for not less than 10 million population, and it is foreseen that it will also cater for neighboring countries like Uganda, Rwanda, DRC Congo, South Sudan, and neighboring counties, Kisumu, Siaya, Vihiga, Bungoma, and Busia, and Nandi County.
The devolution has come in with a lot of changes that we can see in the health services. Previously, services were not easily accessible, but now with the devolution, services are accessible even up to the local areas, the communities. Our people are able to get services from our dispensaries. If the dispensaries are far, we have in the nearby health centers and also level 4 hospitals, which are situated in all the 12 sub-counties.
Health services in Kakamega has actually been going an evolution from the time of 2013 when devolution started to now. We have seen the challenges and addressed those gaps. And because people were initially used to the fact that they have to go to a general hospital, that has started changing. We have everything ready on the ground, starting with the dispensaries, and we have community healthcare workers who ensure that anybody who needs the services, they support them being referred to the dispensary.
We have managed to buy the basic equipment in most of the facilities. When I talk of the basic equipment, we are talking of a thermometer, we are talking of a pressure machine, just to test the blood pressure. We are talking of a glucometer for sugars. We are talking of machines that can test malaria and so on. So we are making sure that the laboratories are equipped with the basic so that we reduce the flow to level 5.
We have also improved our other level 4 hospitals, given them, all of them, 20 million each to expand, to renovate them so that they look like proper hospital. However, we have started 2 other hospitals in 2 sub-counties where the level 4 hospitals never existed. This Yamahubu in Shinyalu, and of course Mumias Hospital in Mumias town. These are level 4 hospitals that will improve referral in those particular sub-counties. The 2 of them will be ready for operationalization before the end of this year. We have also employed over 1,500 staff since inception of devolution to support these particular hospitals. And of course, now we have modern equipment
We envisage to have partnership with the hospitals in India. So we shall have specialists moving from Fortis Hospital in India and working here with our own specialists to provide the highly specialized services.
We have established functional areas in all the areas. In the last 1 year, we have been able to operationalize key facilities which have enabled us to stand out as a referral facility. Of key concern, or rather of key importance, is one, the ICU, which was done jointly between the county government and the national government through the MES project. We currently have an ICU which is fully functional with 2 resident anesthesiologists and a number of specialized nurses and medical doctors and other cadres who are offering support services to the unit. We also operationalized a cancer unit. We realized most of the patients from this region were traveling all the way to Moi Teaching and Referral to access health services, particularly with regards to cancer care. So with the help of AMPATH, we have been able to operationalize a cancer unit. We are grateful to the county as well for having employed a hemato-oncologist. These are specialists who has advanced training in cancer and blood care for our patients. So as we speak today, our unit is able to diagnose, stage and initiate treatment to all our cases, the common cases of malignancy that are found within the region. So we are providing chemotherapy to our patients, and we are also providing palliative care to our patients.
Kanza iko, sijui ni chakula yetu, sijui ni nini. Wacha tukuangalie wakina mama, chakula ile ilikuwa ya zamani. Turudi kwa vyakula zile zilikuwa za zamani. Tuone kama hii ugonjwa ya kanza inaweza tembelea mbali.
I also want to thank the county government because it is ensuring the hospital has got enough consumables. Anytime we don't run short of consumables, they make sure the supplies are up to date, and also there is sufficient supply of water. So we are working hand in hand with the county government, which we really appreciate, and we congratulate even our governor.
Operanya care programs, it was my idea that there was very high mortality, mother mortality, children mortality in this particular county. And I thought I should come up with a program that will reduce this child mortality. And I started Operanya Care, where we start taking care of mothers when they become pregnant at the pregnancy of 4 months. Then we start encourage them to attend clinic. We enroll them to the program so that we are able to remind them when their clinic time is ready, and they go through that program until they deliver. When they deliver, there is because they are really poor mothers that go to this program, either mothers with HIV, mothers who are underage, and mothers who are very poor that end on this program. So after they deliver, we give them some cash incentive of 2,000 shillings and make sure that the baby that they deliver is also given some clothes and so on. And we give 2,000 to assist the mother to buy some milk for the baby and basic provision, and to enable her to come for clinics. And this program, we keep the child on the program for 18 months until the child goes through all the immunization process, all the required immunization. By the time the child is 1.5 years, has gone through the program.
Wakati nilikuwa na mimba ya huyu mtoto, Nilimaliza vizuri, nilienda Lumakanda, nikajifungua kwako, niitisha chochote na usaidizi walinisaidia. Hata nikapata wakanisaidia wako wakanihudumia, si kulipa chochote. Wakanisaidia vizuri, hata wakanipa malisho bora, nikakula nikakunywa. Sasa nashukuru kwa usaidizi walinisaidia. Niliweza hata kujengea watoto rumu yao ya kuweza kulala, wao kuwa na rumu ya kulalia. Alafu wakanipea pesa nikaandikia mtoto maziwa. Na ninashukuru sana.
Nashukuru mradi wa Oparanya Care kwa sababu hakuna malipo yoyote ambayo tutalipishwa, na ile services ambayo tumepata ni services mzuri, na tunamshukuru sana kwa sababu tungelikuwa mahali pengine tungeitisha pesa mingi ambayo hatungeweza kulipa.
From the time the program was initiated in 2014 up to now, we have managed to pay fully for about 13,000 mothers out of the 30 that were enrolled in the program. And then 17,000 have received stipends at varying levels, and they are still receiving. They are not yet gone through with the program.
Ninamshukuru pia Mheshimiwa Wycliffe Oparanya, hasa upande wetu sisi wa mama tunapata matibabu ya bure kwa watoto, na pia upande wa maternity hatulipishi chochote. So ninaomba tu Mungu ambariki na amlinde, aendelee kufanya hiyo kazi na moyo wake mzuri.
Kama ni bereni lazima utumie pesa hapa, lakini saa hii hakuna mtu ameniambia kitu yote, ingaje ndio akulipa hiyo risiti na kuleta hapa. Mimi nimeshukuru sana.
And we are reorganizing the entire healthcare to ensure that there is effective service delivery.